communities, they should also do their part and provide accommodation, because that builds ownership and also sustainability. We are also looking at training opportunities like workshops. Doctors that have been sent to rural areas will be the first that have been sent for postgraduate training, and other cadre of staff too. On the issue of improving revenue base, for Gombe State, I've stated that we contracted a biometric consultant which has freed resources in the health sector. Secondly, we have tried to automate and digitalize e-payment system across facilities, and that has also freed resources. On the larger context, the state government has constructed an industrial park where companies will come and invest. Very soon, we are going to have Pharmaceutical Council of Nigeria conference that will be launched in Gombe, and at least 2 or 3 companies, EMZO, FISTS, and Chief Executive Officer will be visiting Gombe State to see if they can build up factories in Gombe, and I think that will also improve our IGR. Thank you.
Thank you so much for sharing those. Dr. Dangana, the very last.
What I will add from the context of Niger, for the rural workers, for us as a state, the rural allowance is back only for those in the rural areas. Now, 3 weeks ago, we recruited 396 new primary care workers, mostly nurses and midwives, and of course some CHUs. Now, what we did this time around is we are not posting anyone from outside that LGA or community to that place. We sourced for health workers that are just based there. We know you live and work there, so the chances you will leave is not there, and you are a job seeker and you've agreed to do the work. So that we don't have issues of when you post people leave. We just simply recruited based on the locality. That is what we did, just to get them to stay. What we've done in the last 3 years, again, we instituted an annual general awards where we looked for the most dedicated workers, we incentivize, we reward them for their efforts in staying back in those communities to provide services. We give awards, both monetary as well as plaque recognition certificates. And at the same time, what we did uniquely was also we bought equipment for the staff that went from those facilities. We provided medical equipment to their facilities. So just as a way of getting people to stay in those areas. For me, again, one other thing I will add, measures about truancy, medical neglect, the right laws are there in the civil service, just that people are reluctant to impose them, and sometimes we have cases where people have glaringly erred, but where you wanted to take actions, the labor movement or labor union will come in. But for us as a state, we're no longer taking that. We're invoking the right measures as enshrined in the civil code of conduct or in the civil service rules to take disciplinary actions. And of course, we always have the disciplinary committee when such incidences happened. So we've had instances now where people are, if people are not outrightly sacked, but they've been demoted because of that neglect. And we've had a case where some people had actually taken our staff, they've sued for medical negligence. And so that is making people to wake up to their rights, to their duties. And I will just make a comment on this donor-driven program, sustainability. We've done a robust resource mapping in the state. Of course, you look at philanthropists, you look at the corporate organizations, you just look at people that are willing to help. But it's still not bringing the kind of resources you want. What are we encouraging differently for the corporate bodies is, for us at PAC, just adopt one facility. Repaint it, your logo can be there. And then support the government to ensure that that facility has regular supply of essential commodities. It is well equipped. Government should do its part to post the staff there. And then we have a joint mechanism to review progress. So that's what we've done differently. For Rachel asking about telemedicine, I don't want to repeat what Kaduna has said, it is along similar lines. We are just piloting. Of course, we deploy technologies, especially to areas where you don't have the requisite staff or doctors on ground, and they can consult doctors or the right workers directly by that telemedicine, and those virtually, those doctors or health workers can guide those on ground exactly what to do. And in case of the pregnant women, for those that have the danger signs that you need to refer, you should quickly refer them. We're already also talking with another organization, Elephant Care, to expand the scope of these telemedicine services. Let me stop here. Thank you.
Thank you so much, Dr. Dangana. Thank you to all of my panelists. On this panel today, we've heard how states are taking the bull by the horns in improving primary healthcare delivery.
Can you hear me now?
Hi, Dr. Abdul Wahab. Yes, please, we can hear you. Please go ahead.
Oh, sorry, my audio went on for a while, so I was just thinking. So just to quickly address some of those last questions that you asked, the issue of on the issue of scorecard, that whether we have a more holistic scorecard. Yes. So even now, as it is now, so we have the PAC Leadership Challenge, which has broadly two components: it assesses the governance issues on one part, and then also look at outcomes. So the outcomes to also constitute a score that you can be able to know how bad or how good a PhD system is in the country. So we have that one. And then maybe moving forward, we will actually now even advance it, that maybe you want to now have some index. And I think that one is something that is going to be down the line. Then on issue of domestic resource mobilization, I think you have examples. So first, you have to look at the ones that they're doing generally to just increase IGR. So you have states doing different, interventions. For instance, even just trying to digitalize, you had the state IRS trying to digitize the system. So that when they digitize it, I think it will be able to actually improve their collections and all. So what I think, what interests us in health is how much comes to health. So you have examples in states where states have actually tried to be very deliberate in trying to appropriate money for health. For instance, in Kano, I think Kano set up what they call a Kano Health Trust Fund, where a certain percent of the money that they're generating, not just from the federal, but some of the money that they're mobilizing from the states are pooled in one pot, and then it's being deployed for health. So that one is an example. And then on insurance, you have what they call an adoption model. For instance, if you go to Anambra did this thing that they call an adoption model, where they find their local philanthropists. The philanthropists will now, adopt certain families and pay for their premium. So they can say, yes, we are now paying for premium of 5,000 or 10,000 individuals for 1 year or for 2 years. So that way, at least they lessen the burden on government. And then hopefully those people that benefit, ultimately, maybe subsequently, they may be in a better position to start even paying for themselves. So you have that adoption model, you have it in Anambra, and you have it in some other states. And I guess somebody mentioned the issue of the example of adopting a PAC model. This is something that in some of the states to that one is happening. So you have different best practices that are happening across the states in terms of trying to jack up revenue. But I think for health, maybe because I will not have opportunity to say something again, it is important to stress the importance of insurance. The health financing model that is going to help us in this country to actually looking at the experience of other countries is trying to ensure that, yes, by the time we jack up our revenue, we have to pull it in one place and then strategically purchase healthcare. Because as it is now, more than 70-something%, almost more than a three-quarter are paying out of pocket, and then they are going into catastrophic health expenditure. And then when we talk about the partner fund, relatively, when you look at what people spend on the out-of-pocket is 75%, what government spend probably around 14%. The partner one will be around 5-8%. Although because they monitor, there's an accountability, we see a lot of things from what the partner do. So I think if we have an insurance scheme that we're able to have it's not fragmented. We pull our resources into one place, and then where we now pay for families, I think we'll be able to actually solve some of these issues around, health outcomes, because a lot of families don't go to hospital because of the fear of what they are going to pay when they get to the hospital. So maybe if we can jack up, now that we're just having about 7 million, 8 million people on insurance, I think we need to have a quantum leap, not just thousands, but we have to go into millions. So, and I hope that the target now said that we want to achieve 50 million, we want to get 50 million people on insurance. That will be it. I think it's a target that is doable, and then it's something that we need to work towards it in the next 4 years. And we've calculated the numbers in terms of the amount that is needed. The premium of about 15,000 per person, you need 750 billion. It sounds scary, but I think if we put our thinking cap on, we'll be able to see how best to generate this money. And then some of these issues we're talking about, health outcomes, I think you see Nigeria, all these description in superlatives that we have the highest, I think it will now be positive ones. That's something that we must have done well. Thank you.
Thank you so much, Dr. Abdul-Wahab. Before we close this panel, Dr. Baobele.
Behind the pillar. I'm
Oh,
here.
okay. Please go on.
So to address the question you had raised about the portal, the PAT portal is a pilot program. And then what we have done is to create modalities by engaging members of the community. That way, citizens can provide their feedback. We're also looking at where patients who utilize the facility can provide their feedback, and community members can also provide their feedback. We're also encouraging a lot of young persons to have access to it, because over the course of time, we've seen a lot of people within the active age group not being involved in the health system. So that's why we're also making it like a digital platform. Now, going forward, we have room. We've been working with stakeholders at NEMCHIC. We've been working with the executive secretaries here. We're also looking at ways to make adjustments to scale up. So they being involved in the project, validating it, will also give us rooms to also expand and have methods where persons who do not have technology can have toll-free numbers where they can call in and we can record their findings. Now, it's very important to know that validation is something we take, and privacy is something we respect within BudgIT Foundation. So what we have done is put out the portal, people can record their feedbacks, but it is not published until it is verified. So validation is very important to us. So we have it, nobody can delete it, but it's not published. So we go back, we engage with the facility, we engage with the community. Our stakeholders at the community level, who are community members that we've empowered, they go back and see, okay, what can we do? Now, as we also progress, we also provide progress reports on where we are to the state government, to the executive secretaries, and to the community members. We provide a feedback mechanism. So a dial-in section is something we're looking at introducing in the next phase of our engagement. Thank you.
Thank you, Dr. Davidson, for sharing those. So we have come to the end of this panel. We've heard so much about how states are improving primary health care delivery. We've heard about the most significant challenge facing our healthcare sector, which is human resources for health. And we've heard how these states are improving production and retention. We've also heard about community accountability mechanisms and financing. And we've heard also from the Nigeria Governors Forum about a scorecard and how to improve health insurance coverage for the poor and the vulnerable. So thank you so much, everyone, for listening. Thank you to my esteemed panelists. Thank you for sharing from your experience and your expertise. And thanks to BudgIT Foundation for facilitating this. Thank you.
Thank you very much. Let's give them a round of applause. Before you leave, I would like you to take a group photograph, and then we'll take a joint one with His Excellency, Country Director and representatives, Dr. Kunola, as well. So if we could get the media crew to take them alone. Yes, all 5 of you together. And then you'd be joined by the people at the high table. We'll do them first, and then they can be joined by His Excellency and all other officials. It's a very, very interesting session. Lots of questions, lots of data, lots of insights. And if it would interest you to know, I hope I'm not ambushing them, but we'll be having a Twitter Spaces with all the ESs, well, X Spaces on Friday. Sorry, I'm just telling you now, sirs. But we'd like to have a deeper discussion online so we can have much more people involved. Very quickly after this, we'll have our vote of thanks by our growth and strategy lead, Mr. Joseph Amenowon, and then we should call it a day. DG Nigerian Governors Forum, please, you can come up and join them. Dr. Kauru, I hope he's still here. Okay. And the representative of the National Primary Healthcare Development Agency, Dr. Garba, you can also join them. And the head of research, BudgIT, can also come and join them. Yes, and yeah, you can join them on the first level of the podium, of the stage, sorry. Thank you very much, sirs. Thank you very much for your contributions. A great session all around. So, we've come very, very close to the end, and I'll be calling Mr. Joseph Amenowon up to the podium to deliver his closing remarks and vote of thanks. Please, let's give Mr. Joseph a round of applause, please. A round of applause for Mr. Joseph Amenowon.
Good afternoon, everyone. Good afternoon, everyone. Just to say that this morning, while we were coming here, I was coming to register too, and I saw an individual walking ahead of me, and I didn't even know who he was. It was when we got into the hall that I was told that that's actually the governor of Kwara State. I'm like, how is that possible? So, Governor Abdurrahman Abdurazak, we want to say a big thank you to you from BudgIT and from all our friends here for taking out time to be here, and not just being here, but being here all through. We really appreciate that. And we say a big thank you to you. In the course of the meeting, there were a few things I was thinking about. I said, what do we need to do? What we have to do? And what we can do? What are we capable of doing? What are we doing? And what we could do within the context of the complexities of our political economy. And some of those conversations we've had today, especially dovetailing into how best we can deal with ensuring that primary health care is delivered to our people. How are we going to work around the constraints of just focusing on federal transfers? So ultimately, some of the conversations we've gotten here, and importantly, the recommendations from the state of states have given us pathways for us to follow. And it will be important to see how we do that. But in all this, we need to also acknowledge all the work that went into making this a reality, especially the production of the state of states. So I would like to call for recognition the team that have been responsible for working this out. First on the list is Inibong Usen. Please stand up for Vahala Kwaga. NAB Okpaoluwa, please, you guys stand up for recognition. Stand up, please. Damilola, Tosin, Sheyi, Ibukun James, and importantly, our communications, media, and digital design team. Please, let's have you all standing, please. Please, can you please clap for them? And let's not forget, Gabriel was the supervisor. He was the project supervisor somewhat. Although along the line, Sheun sneaked himself into the conversation. So we'll say a big thank you to all. But again, we must thank all our partners and everyone who has supported us up onto this journey. Importantly, the bill and I'm being affected by some Bill and Melinda Gates Foundation, all our partners in the development sector, and all our friends who have come to this event. We say a big thank you to you all and wish you all a safe journey back to your destinations and to your respective places. Thank you again. Thank you so very much.
You know how I feel. Sun in the sky.
So we've come to the end of 2023 State of States. Please network, say hello to one or two people. Okay, sorry, national anthem before we leave.
It's a new day, it's a new life for me, and I'm feeling good. I'm feeling good. Fish in the sea, you know how I feel. River running free, you know how I feel. Blossom on a tree, you know how I feel. It's a new dawn, it's a new day, it's a new life for me, and I'm feeling good. Dragonfly out in the sun, you know what I mean, don't you know? Butterflies all having fun, you know what I mean. Sleep in peace when day is done, that's what I mean. And this old world is a new world and a bold world for me. For sands of the pine. You know how I feel. Oh, freedom is mine, and I know how I feel. It's a new dawn, it's a new day, it's a new life. It's a new dawn, it's a new day, it's a new life. It's a new dawn, it's a new day, it's a new life, it's a new life for me. And I'm feeling good. I'm feeling good. I feel so good. I feel so good.